Now's the time to finally realize we the people must make some choices. If we want single-payer health care, now's the time to raise our voices.
Hi everyone, I'm Munif. I'm a fourth-year medical student from Pacific Northwest University. I'm also on the board at PNHP Washington, been on it for maybe a year or so.
But my name's Gleb. I'm a fourth year student also at PNWU. I'm doing my rotations out of Olympia right now. And I've been a board member for just a couple months actually. But yeah, nice to meet all the new faces.
Hi everyone, my name is Omar. I'm a third year medical student at UW School of Medicine Seattle site, and I'm a part of the SNaHP leadership chapter at our UW Seattle. So very nice to meet all of you today, and yeah, forward to the meeting.
Hi, my name's Alan. I'm a third year undergraduate student at University of Washington. I'm also a part of the board at for SNaHP for UW, and excited for this presentation.
Hey, I'm Anton. I'm going to be a second year student at PNWU, and I'm going to be part of the SNaHP leadership going into 2025, and I'm happy to be here.
Hi, I'm Simi Kaur. I'm going to be a second year student as well as PNWU, and I'm going to be the new incoming SNaHP president for this next year, and I'll be working with Anton and Munif, and I'm excited to be here.
Hi everyone, I'm on the left. I'm almost home. I'm a fourth year medical student at the University of Washington Medicine. Also a board member with PNHP Washington and leadership with SNaHP UW since I believe 2017. So going on quite a while, but I'm looking forward to the presentation.
Okay, David, take it away. Well, I'm here on Mercer Island, and my understanding is that once upon a time, the Snoqualmie tribe of Indians had a couple of villages here so they could go fishing in Lake Washington. And then the island was pretty much ignored until the Americans from Seattle put boats in Lake Washington and came over to have a look. So we're here courtesy of Native American ancestors for generations.
And we're spread across the state here, and there's basically everywhere in this state has been occupied by Native American communities, and many of them are still here, and we acknowledge the debt we owe them. It's a recent activity. We are in the process of updating our website, which is a little clunky and old-fashioned, and we're going to have a bunch of drop-down menus, so it'll be easier to navigate around and find what you're looking for. And we've got, I think, 4 people working on that with a professional, Simon Hutton, who does it for One Payer States, and I think also involved in Healthcare for All Washington's website. So we had a good meeting with him a couple of weeks ago, and we're going to be meeting this coming week and follow up on that. And the hope is we can get our website updated in the next month or so. And also we're going to focus more on our social media, which Simon also has a whole lot of knowledge about that. So that would be our Facebook page, and I don't know what else we're going to do other than Facebook, but there's other things out there that other organizations use to good effect. So hopefully you'll be seeing that coming before our next meeting. I would like to say something about our next meeting, which is going to be with Bernard Caraballo, who's going to be talking to us about how Trump's BBB or Big Bad Bill affects people with disabilities. I've known him since 1968 or something like that. He was born into a disadvantaged family in New York City, and his family really didn't have the means to take care of him. So they put him in Willowbrook, which was supposedly an institution that New York State took people like Bernard, and they were supposed to educate and physically and educate them mentally as much as they could do. It was a place for both physical and mental, if you want to say that, disabilities. Bernard, cerebral palsy. So he was there at age 3 to age 21. And he had absolutely no education. He was just lying around on the floor like most of the other 4,000 residents of Willowbrook and on Staten Island, which I and some of my colleagues happened to live on, and eventuated in the parents of and relatives of the people who were there, and there were 4,000 of them ended in a class action lawsuit in federal court against the state of New York. And it was a class action lawsuit was won by the parents, and it eventuated a few years later in the closure of Willowbrook and the transfer of those people who were living there to more community-based places that could care for them and would provide education and so on. So Bernard went on to get educated and became a big advocate for people with disabilities and got a job in the city of New York for many, many years, where he was the advocate and had the means to support people with disabilities of various kinds. And he eventually got a Doctor of Humane Letters from an institution in New York City. So he's been gracious enough to come on to talk to us about what the effect of Trump's bill that attacks Medicaid has on people with disabilities. And it's pretty savage. He wrote an editorial. It's just amazing. It's just full of facts, and it's a brilliant editorial. So I'm hoping that he'll still be awake in New York City. Maybe we'll have to move our Zoom meeting up until 6 o'clock to help accommodate him. But so I think we should all look forward to that.
That's the 20th.
As far as locally, healthcare as a human right is having its general meeting in the form of a cookout and gathering by a beach. And I'll have some information about that. Healthcare as a human right thing is called the Summer Cookout and General Meeting on July 27th in Northeast Tacoma area. And
it is my distinct pleasure to introduce Munif Chowdhury, who's one of our board members and has been a valiant leader of the PNHP SNaHP chapter over at Pacific Northwest University in Yakima for these last few years. Munif grew up here in Puget Sound and attended the University of Washington, where he graduated with excellent GPA, despite the fact that he did research and has been very busy with a whole variety of different volunteer activities, including one that's near and dear to my heart, which is where we ran into each other, which is the Seattle-King County Free Clinic that's held every year. Munif is now in his 4th year at the Yakima School at Pacific Northwest University Health Sciences, and we look forward to what he's got to say, and also an exciting 4th year for you, Munif.
Great, thank you, Hugh. Yep, my name is Munif. I'm a 4th year medical student. I'm currently based in Tacoma. I'm doing most of my rotations. I've been part of establishing the SNaHP chapter at PNWU, and now I'm on the board here. Glad to see some of you come out, especially so many medical students. And this will be kind of like a group presentation. I'll get us kicked off and I'll present some of the slides, but we'll have some other folks also jump on as well. I'll try to introduce them too as they come on. So SNaHP, Students for National Health Program. Here's Washington State chapters we got. Before I talk about SNaHP, I want to outline the medical pathway, just to give some context on the pathway we go through to become doctors. Because even though SNaHP, our goal is to incorporate all health professional students and undergraduate students. As of now, it's kind of dominated by medical students. So I think it helps to know the pathway that a lot of us are going through. So an undergraduate, this is usually 4 years long. This is where we do our bachelor's degree and we finish our pre-med requirements. Pre-med requirements are like the courses we need to take, like general chemistry, biology, taking the MCAT, getting letters of recommendation, experiences in research, leadership, volunteering, things like that. So we finish our undergraduate. Some people go straight into medical school. Some people take gap years to strengthen their application or to make some money or for various reasons, maybe family reasons. But then you start medical school. Medical school is 4 years long in the United States. The first 2 years or first year and a half is called like the preclinical years. This is when you're in the classroom, in the lab, dissecting cadavers, things like that. And the last 2 years of medical school are the clinical years. This is where you're doing your rotations. You're getting that clinical experience through various specialties, from family medicine to surgery to OB-GYN. Then after medical school, some people take a research year to strengthen their applications, but most folks after medical school, they go straight into residency. Residency is required specialty training. In residency, you are a doctor. However, you're not licensed to practice independently yet. Everything you do needs to be signed off by an attending. An attending is like a fully licensed doctor who can be independent. So residency can be 3 to 6 years, depending on what specialty you pick. After residency, most folks just become attendings. They become the full doctors, the ones you see in the clinics and in the hospitals. However, some residents will go on to do fellowships. This is optional subspecialty training. It could be also like 1 to 3 years, sometimes more, longer if they want to be even more subspecialized in the field. Here's a chart I made. Hopefully it shows up good on the slides. It outlines kind of 3 main pathways, or 3 common pathways for family medicine, internal medicine, general surgery. Family medicine are usually the doctors you see in the clinic. Internal medicine are usually the ones you see in the hospital. So everyone does 4 years of medical school. Residency here is 3 years for family medicine and internal medicine. For general surgery, it's 5 years. I think they do more years because surgery, just a lot of those surgical skills are just learned through repetition. You just gotta do it to get good at it. And then, so there's these fellowships, the optional fellowships. And as you can see for family medicine, there's things like obstetrics, addiction med. Usually family medicine fellowships are like a year long. Internal medicine, there's the ones like cardiology, pulmonology, and those tend to be longer, maybe like 3 to 4 years. And then general surgery also has fellowships if someone wants to be the specialist in doing transplant surgery, or they want to do surgery with kids, things like that. And then after that, whether you go straight from residency into practice or residency into fellowship into practice, that's when you become that full doctor. And just those are some various things that you can do. As a family medicine doctor, you can be a family doc, you can do full spectrum, birth to grave, internal medicine. Most of them work in the hospitals, but some do primary care. And surgeons, you have general surgeons who do everything from hernias to taking out gallbladders to the subspecialists who do transplants only, for example. So the reason I wanted to outline the medical pathways to give some context as to the medical education pathway, it can be disjointed. There's a lot of moving around, a lot of moving pieces. And for medical students and for residents, it can be tough because a lot of the time we're just trying to keep our heads above the water. So it really feels like maybe that there may not be opportunity for advocacy or opportunity to get involved and really make that change that drew a lot of us to medicine to begin with. And then by the time our 7+ years of training are over, maybe we've kind of lost that spirit. So that's kind of where SNaHP comes in. As a student group of PNHP, of course, we share the same goals. We advocate for universal, comprehensive, single-payer national health insurance, and we also have strong themes of anti-racism and social justice and social determinants of health. But SNaHP also has a few unique goals here. We want to educate medical and health professional students about our healthcare system. Our schools are really good about teaching us about anatomy and pharmacology and all those things, but the education about our healthcare system can be very bare bones at times. Maybe we just cover the basics, what's Medicare, what's Medicaid. We really don't do a deep dive into our healthcare system and why it has the problems that it does and how it prioritizes making money over helping people, for example. Getting medical students and health professional students involved in organizing advocacy is another big goal. The thing with medical school is it's a lot of peaks and valleys. They can be periods of time where we just kind of disappear, and then there's periods of time when we have more free time than we expected. So I think we can help students realize that there's various avenues to get involved with advocacy and opportunities that does work in our busy schedules. Collaboration, obviously a big goal. We're stronger with numbers rather than being individuals. And probably one of the biggest goals of SNaHP is to build momentum, especially when it comes to medical students heading into residency, becoming future physicians. We can teach people now, get them involved now, get them excited and build these bonds now. It means later down the line, they're more likely to stay involved with advocacy and use their voice as they become doctors, as they become more influential, as they make more money, and they have more of the ability to impact change. And finally, produce change within our schools, our professional societies that represent us, and within our local communities as well. We don't always want to be shooting for the stars with national goals, even though that's the end goal. There's a lot of things we can do in our local communities. Here's some photos from the previous national conferences. The one on the left was, my left, was from last year. We went to Chicago. State Senator Pramila Jayapal, she gave an excellent speech there. And we got to take a picture of her as well. It was a great meeting. And the picture on the right was from 2 years ago. That was in Atlanta. It was my first meeting. Again, it was a great time. lots of great people, learned so much, and it's just great seeing that there's a whole community of us out there. So there's 3 medical schools in Washington State. There's 2 MD granting institutions, University of Washington, WSU, and there's 1 DO granting institution, the PNW College of Osteopathic Medicine. I looked this up earlier, for our state, for the population we have, 3 schools has actually been on the low side. However, University of Washington does have 2 campuses, the main one in Seattle and a smaller one in Spokane. So I think that maybe helps make up the difference a little bit. Here's a map showing where the main campuses are. So University of Washington was established all the way back in 1950, located in Seattle. They're a big force out here. You see UW medicine everywhere. There's Pacific Northwest University, established in 2008 in Yakima. They have a bit more of a focus goal, producing a lot of primary care doctors who will stay within Washington State. They're well connected with the Central Washington communities and tribes in that area. And we have WSU, established in 2017 in Spokane. And again, they're serving more the eastern side of the state. However, they've been expanding very rapidly, and you'll see their students in Central Washington, Eastern Washington, all over, Western Washington, all over. And it's not on the map, but UW also has a branch in Spokane. So PNHP Washington's goals for SNaP in Washington State. One of our major goals is we do want to start a 3rd SNaP chapter in Eastern Washington. Ideally, the chapter will encompass students both at the UW Spokane and WSU sites. Maybe they can have some kind of linked chapter going on. We've had a few students reach out to us with interest. We're still working on trying to get something going there. However, we always have somebody reaching out to us. We just need to get one of them to kind of stick and build that momentum to keep like a student group up and running, and they'll keep recruiting for the next years to come. Another goal, recruit resident physicians who are involved with SNaP. We're starting to get a lot of SNaP's really exploded in the past couple of years. A lot of chapters have been popping up around medical schools and state schools and undergrad programs around the country. And a lot of these folks are becoming residents now, and they're coming to Washington State to do residency. So we want to hopefully get them involved. However, getting residents involved is harder than getting medical students involved, because they tend to be even busier, but it's definitely a big goal of ours. We want to send SNaP leadership this year to the national meeting in Washington, D.C. in November. We have leadership on this meeting from UW, from PNW. Fingers crossed we'll have some from WSU to send in time as well for the meeting this year. And we want to support our SNaP chapters. A lot of them have great ideas. They think of their own cool initiatives and innovative things to do. And we want them to keep doing those. And hopefully we can kind of help in the background by providing funds for food, which is a big driver to bringing people to events and connecting them with speakers, and or providing our own board members as speakers. So just whatever we can to help them out to grow and expand and better fulfill their missions for their schools and local communities. So next, for PNW SNaP, the SNaP chapter at PNW, I want to hand it over to Gleb. Gleb's a good friend of mine. Him and I, we established the SNaP chapter at PNW in 2023. And yeah, he's also a board member on PNHP Washington, and he's also very involved with Washington Physicians for Social Responsibility, a board member with them as well.
Awesome. Thank you, Munif. And for the record, I did not have as good of a GPA as Munif in college. I really appreciate you pointing that out. But as Munif said, my name's Gleb. Munif and I established the chapter in 2023. We kind of met early on in the year and both connected over a passion for single payer, and kind of the rest is history. That first year, we had a heavy focus on growing the club and getting it really established, because we kind of recognized the possibility of it not really getting that momentum to stick around. And so we really focused on a lot of kind of like big events, kind of recruitment and education about single payer, before eventually transitioning to more advocacy-based projects. So some of the events that we've taken part of in the past few years included like recruiting people for the Seattle King County Clinic. We basically coordinated a bunch of people from our cohort and our school to all go at the same time and like stay together in Seattle to kind of facilitate volunteering there. We've hosted a couple different physician and expert panels, some of which we did with UW. We collaborated and had meetings like over Zoom. We did this past year. I was actually super proud of the new officers led by Paige last year, but they led a series of advocacy trainings leading up to the DO Day, which is kind of our DO WISMA summit equivalent. And basically, these advocacy trainings focused on really the essentials of, lobbying with your representatives, but also a more in-depth dive into what single payer healthcare is. And then, as Munif mentioned before, we've also taken part in the annual PNHP SNAP meetings. I just really wanted to quickly point out some of those photos, but the top left was our last year's DO Day cohort. Top right was from Seattle-King County Clinic. We actually linked up with folks from several other DO schools. And then bottom left was actually our PNW squad with our old advisor, Dr. Baldwin. He's now in Arkansas working at their new med school. So in this year, kind of a brief background. So before Munif and I left for our clinical rotations, we decided to actually merge our school's SNaHP chapter with our school's Students for Human Rights and Social Responsibility chapter, which essentially is their Washington Physicians for Social Responsibility chapter. And we decided to merge them to really combine their resources. And for the same reasons that Munif mentioned, they both have a huge emphasis on the social determinants of health. And we felt like they had a very similar mission in that regard. So ever since they combined, it's now been referred to broadly as the Student Activist Coalition at PNWU. But we still have specific SNaHP and WPSR leadership within the student organization. For the 2025 to 2026 academic year, the clubs, as they introduce themselves, it's being led by Simi and Anton. This is actually like the first time I've seen you guys like live in any format, so it's nice to virtually meet you. But essentially, the goals for this year are pretty similar to our past goals, is really continuing to increase student engagement, continue to work with guest speakers. We're working on actually getting Dr. Hugh Foy to deliver his Healthcare 101 talk in September. Really looking forward to hearing about it. And then also kind of renewing our support for the Washington Cares Fund, which gets submitted pretty frequently during the legislative sessions. But yeah, that's pretty much catching up PNWU SNAP up to date. I'm not sure who's talking about UW SNAP, so I'll hand it off to the UW folks.
Hi, Clip. I will do that. I will start the talk and then Alan will join me. So, yeah, I will talk about our chapter in UW, and I will start by talking about our events for the upcoming year. So, in our meetings, we usually plan for like half events for half of the year, just so our events are up to date and keeping up with the current events that are going on. So, first, for our next academic year, our goals to start with a tabling event at an RSO fair that UW School of Medicine holds each year, and that with the goals to recruit new members and to recruit more attendance just and to increase our reach. And according to that, once we get that date finalized, our first event of the year is going to be a mixer where we have the new members invite from residents who have worked with SNAP in the past and physicians, where we have a mixer, we have food, ice-breaking activities. We have a watch party, and for that, Natalie, also a board member in SNAP, is not able to attend today. However, they're going to deliver a presentation about a single payer system and and that's what is going to be the content of our arch party, and that's going to be the first event of the year. We're yet to finalize the date for that, soon to do so. And after that, in November, we have on calendar the annual PNHP meeting and the SNAP summit. And after that, we are going to do a debrief event to our community and students on what we have learned in the summer and what's going on to keep our community informed and up to date. Following that, in December, with the start of the Medicare Advantage open enrollment period, we are planning in holding a couple of activities. One of them that we have decided on is visiting nursing home or multiple, depending on the capacity and number of members then, and to perform activities simple as just like playing a bingo game about Medicare and and the goals is to increase awareness, spread awareness for people people who are basically considering Medicare and to educate them about Medicare Advantage. Lastly, for the second half of the year, we have yet to decide on specific events. However, some ideas include hosting notable guest speakers and cooperating with other local organizations, because I believe that to Alan in a bit to share some of our goals, but among our goals really this year at least is to build community and to increase our reach for SNAP. Basically, increase the number of students in our university and people in our community who are in our movement, who are joining us and for our events, advocating with us. And some ideas is cooperating with other organizations similar to what Gleb and Munif discussed in their chapter. Is we could also cooperate with other RSOs, or not necessarily RSOs, but general organizations in the community that have similar visions, similar goals, and that is co-hosting events with them, cooperating with them for the goals of increasing our reach and reaching more people in our community, hopefully to recruit more members in our movement. And we can move on to the goals slides, and that Alan will take lead on. Oh, sorry, if we go back a bit. Yeah, just lastly, I wasn't able to get a lot of pictures, but that is one of three of our board members, John, Jalen in the middle, and myself from the conference last year in Chicago. We don't have many other pictures, and I think that could be one of our goals, is to get better at getting pictures, hopefully next year. And also, we just started a new Instagram page, and that's our logo in the top right corner. This is a barcode to our Instagram page, and I think that's going to be helpful in to reach more people. Now we are on Instagram, a popular social media platform, and hopefully we're going to increase our reach. And yeah.
Thanks, Omar. My name's Alan, third year undergraduate student at University of Washington. I'm also part of the board at UW, and our mission statement is to learn and advocate for healthcare equities, most notably a single payer. And we have lots of goals, but our main four goals include one, like what Omar said, was trying to get more students. Our UW SNAP chapter is mostly UW med students. I'm probably the only undergraduate student in there, so for me, trying to get more undergraduates to join. Omar talking about the events, we're doing the RSO tables for UW School of Medicine, which will help build our community. But we're also going to do a UW undergraduate one. There's like the same thing, but just for the undergraduate side. So then we could get more students to come and therefore be better at spreading our awareness. And then two is just make sure that every student's up to date with like the bills and the laws. And we try to do this by bringing guest speakers to help us learn about the new laws and what's going on. Third goal is to make up so the fundraiser that we were trying to go through was to make money so then UW SNAP students could go to the national meeting. And we weren't sure what to do yet, but there's a meeting for PNHP next week that we'll discuss some details that we could go through. And then for our last goal is just to make sure we collaborate with other RSO groups to see like other different perspectives. Like we have the same vision, but there could be multiple perspectives. So just to make sure we see every different perspective.
Definitely. And just to cap it up, lastly, to summarize, like one of our main goals really is to create a platform, to create an avenue in our institution where healthcare students come together and discuss current events, changing events, for example, the new bill, its implications, just to have an avenue, to have a platform in our institution where students get together and meet, discuss, and potential brainstorm ideas to advocate, to change things. And by us making that platform, filling up that space, which sometimes might be empty in our institutions right now. So filling up that space and making a single payer health system advocacy integral to it is one of our main goals, hopefully, and that is going to be our events this upcoming year is really going to circle to get us closer to that goal.
Great. Thank you, Omar and Alan. And just before ending it here, I just want to give a quick shout out to John Kearney. He's a fourth year medical student at the University of Washington. He's great. He's invaluable in helping Gleb and I set up our chapter at PNW, and he's just been part of this for a while.
I
So
just
just
wanted to add that, it's so amazing to see you all here in one place. And we didn't list this formally, but I think maybe one of UW's goals, informal goals, is trying to one up our PNWU colleagues. You guys are killing it. So excited to see you all here. And yeah, Gleb and Munif, you guys have done such an amazing job, like picking your chapter up and building it from the ground, and really establishing like a strong cohort there, and building a system that's definitely going to be sustainable for years to come. Just looking at some of the new faces as well. So I might add that to like one of my like informal goals, but it's not a competition, but we always say that, but it actually is a competition sometimes.
But yeah, that's it. I put the emails for me, Gleb, and John. We're all officially like on the PNHP Washington board as well. We're kind of involved with both. Feel free to contact us if you have questions or would like to collaborate, or just anything that you want to get in touch with. And I guess we'll start the Q&A now, if there's any questions.
Okay, well, we can start the Q&A. I'm supposed to lead this section, so we'll start with Chris.
I'm just wondering if you have any leads or starting places for establishing a SNaHP chapter at WSU in Spokane. I'm happy to do introductory presentations or programs about single payer, slideshows, whatever, to help get us started. But I'm just curious if you have any leads so far.
We've had some students reach out. We weren't able to stay in contact with them really. We tried following up with them. But if you want to provide your email, next time maybe we could CC you in those email discussions. Like every 6 months or so, we have a new student reach out to us. WSU is just pretty new. The UW cohort is small there. So I think in the WSU cohort, I think they're only around 80 or 90 students too. So just the size is a problem. They may have to do something like where they have an overall advocacy student organization there. Maybe they have one chair dedicated to SNaHP. But if you want to provide your email, we can CC you next time with one of those. They might be more motivated when they see someone who's actually local to them, who might be able to serve as a help out. If anybody else wants to add to that.
Yeah, and Chris, I think this kind of touches on one of the chronic issues with putting together an advocacy organization such as this, especially with people who are as busy as they are in medical school. So just thinking about like Seattle, like we have students who come in, but the UW program is so unique in that, and I think PNWU as well, in that we don't stay in Seattle, right? I'm doing my best to stay in Seattle, but even sometimes like we have rotations in third and fourth year where we rotate to Montana, or for the PNWU students, they're going to the four corners of Washington State. So, and the same applies to Spokane students. A lot of them will, in the third and fourth year, do rotations in Seattle. I think one of my classmates, he was from Spokane, but did all of his rotations in Seattle. And the same applies for other students there. So it's kind of just a problem of continuity. And it's something that we've been kind of running into a wall with over the past like many years as I can remember. But yeah, we definitely get students who reach out. So yeah, if you send us your contact information, we'll try our best to connect you.
I just want to thank the students for all your hard work. I've been really impressed. You guys are so extremely busy, but you really have gone out of your way to be active members of the board and to show up for a whole host of different things. As you pointed out, Munif, you guys were very involved with the Seattle King County Clinic, which is an all-volunteer organization, among a whole lot of other things. And I think I'll do my part. I've got a couple of connections with one student from the Seattle King County Clinic who's just starting in the UW program in Spokane, and she's very interested, as well as I've got a couple of neighbors across the street who are just finishing their first year at WSU over in Spokane. So I'll reach out to them and get their addresses for you as well. And lastly, as Munif said, we're trying to organize for me to come over to Eastern Washington. I'd be happy to do it in Yakima and in Spokane during September. and present some information I put together, which is just kind of an overview of the U.S. health system. We'll get that going in September, and I just want to say thanks for all your hard work. I really, really appreciate it.
Yeah, I've got first a comment, then a question. PNHP National, the executive committee and the board is really impressed with SNAP chapters around the country and is doing everything they can to support them. So if you have anything that you'd like support at the national level, you could go through us or just go directly through them. I think the national board now has at least, what, 3 or 4 SNAP members are on the board with full voting capacity. So that's something that's new with this new regime that's running PNHP the last 2 or 3 years. Our chapter encourages and helps local SNAP people to go to the annual meeting. And I think we've been very bragging about how many SNAP students we've had at the last couple annual meetings anyway. I think we had like the biggest delegation, I think, John, didn't we? Anyway, it's so we'll definitely be doing that. And the other thing is there's the committee of interns and residents, and I see from emails that they're having some kind of a walkout or something tomorrow or the next couple of days. Does SNAP overlap CIR? In the old days, didn't you, Hugh, have something to do with them at Harborview?
We weren't members of CIR at that time, but we organized a UW House Staff Association back in 1980. At that time, kind of the benefits and salary support and everything for the UW residents was abysmal. We were in the 3rd percentile nationally in terms of salary. We got 1 week of vacation. There was no family or barely any sick leave. So there was a general strike. The residents actually walked out for 2 days. That started a whole lot of reform. Salaries got better, benefits got better. They had an active committee that reported directly to the dean, made up of residents and fellows. So like anything though, the default is administration to ignore entities, particularly if they can get away with it. And it just periodically takes a lot of activism and speaking out. So I think the residents are doing that right now, even though salaries are now set at the 50th percentile for like institutions on the West Coast. It still is barely enough to rent an apartment and live in Seattle. So there's a lot of issues. So I think the residents are very deserving of our support. They've got a website, they've got an association that's independent of the U.
That's CIR.
I don't know if they are members directly of the CIR or not now, David. I forget.
Yeah, they recently joined CIR, but I think they kept their original name of RFPU, Residence Fellows Physician Union. But my understanding also is that there's been a lot of overlap with PNHP, SNAP, as well as CIR. Every year CIR shows up in force at our national meeting, and we've had presentations from some of the organizers there. But I do like the question because it makes you think that we can utilize, we previously utilized SNAP lists to try to recruit interns as they move out to Seattle because PNHP National does track that data. But it could also be useful to try to, I don't want to say track, we could say track down CIR residents and interns and, try to see if there's some collaboration there. But just to get to answer your question, no, I don't think we have any formal plans to join the walkouts.
Can you guys send that stuff around when that's going to happen? Because I thought I had it on my calendar, but it looks like it fell off.
So I'm curious how the various SNAP chapters at PNWU and UW, I guess we can't find out about WSU, but how well are you received by your respective administrations as far as helping facilitate events, meetings, etc.? And, Yeah, and do they support your mission in developing or in promoting a single payer healthcare plan? I guess I could ask Munif first for PNWU and then Omar for UW.
PNWU, I feel like our first year we had very overwhelming support. A lot of people at our school, I'm not sure if this is similar to other schools, but there's like a list of steps you need to go through to establish a student organization. And when it came to the part like gathering signatures and things like that, we had no issue. And we had pretty good turnout for our events. However, that could also just have been kind of maybe like the novelty of it is our first year. We made a big effort to make sure we always had good food and things like that. That definitely helped. But overall, I think to answer your question, I think, single payer in general, I think surveys have shown that for physicians, at least over 50% of them support single payer. And that's folks in practice. I think with the younger generations in our med schools, we've definitely seen even more. I think a lot of people are supportive. I think just the thing, it comes down to people that don't know what they can do. They don't know if they can do anything. And it's kind of working on that education and involvement aspects. But I feel like at PNW, we've seen a support from the majority of the student body.
I just, the CIR demonstration is going to be this Thursday, 12:15 to 1:15 at Harborview, where they're having a quote, rolling 5 to 15-minute walkout that will not impact patient care. Snacks, water, and signs provided. Healthcare is a human right puts out every couple of weeks a newsletter about what's going on.
I just wanted to speak really briefly to the support from University of Washington. I think kind of in alignment with Munif said, like University of Washington has been overwhelmingly supportive of our chapter and some of the topics that we speak to. As a matter of fact, I'm just trying to remember all the events that we've held over the last couple of years, and numerous of them, if not every single event, we've actually had UW faculty leading the events, not so much hosting the events, but they're guest speakers for the events in a formal capacity, right? So obviously a lot of these positions and these faculty that can't represent the University of Washington and its opinions, but they were introduced themselves as UW physicians, UW faculty, and this is their opinion. And a lot of these people actually do research as well. I'm thinking of the most recent talk that we had a couple of months ago with a physician who really specializes in QI and QA projects, quality assurance. And, he just gave a talk on how exactly we finance healthcare in the United States. And it was so informative, and he's wholly in support of single payer system. And, we've had faculty, formal faculty who I've also done clerkships with, given our single payer one-on-one talks. And, definitely want to give a shout out to the PNHP Washington board as well, looking at David and Hugh and some of the other people here being from the University of Washington themselves or having practiced or worked with students over many years. So I just want to say that overwhelmingly, it's just been supportive, and we've had access to so many resources at our school to be able to host tons of events. I've definitely hosted a lot of Zoom calls on my UW Zoom account, which I never asked permission, but I'm pretty sure that's kosher. But even before the pandemic, we've also been able to had no problems in hosting events on campus using campus equipment, et cetera, et cetera. So really no problems from our institutions. We haven't gotten to the point yet where, say, UW faculty, Dean of School of Medicine, or Dean of Medicine, et cetera, or any chairs of departments have published letters in support of single payer. That could be an interesting project for the future, and not sure how receptive that would be, just considering a lot of times UW has remained apolitical in a lot of different venues, but that's something that we can think about as well.
Well, thank you for your answers. Okay. So Ted Weinberg has a question.
Yeah, hi. So I guess I'm trying to figure out the long-term vision of how do we get there, right? And I've been sketching, as I sometimes do, what would 2060 look like? Let's say in 2060, the then president of the United States signs into law the first single payer universal health care plan. How would they get there? What would be the let's say 4 years before that in 2056 is probably when the US Congress would start looking at the 10 different states that at that point have single payer universal health care and say, wow, we've got all these different states doing it in different ways. Let's create one common way of doing it across the country so we don't have all these different random ways of doing it. Let's pick the best ideas from the different ways the different states are doing it and start formulating that. And that means some years before that, say 2052, the number of states that have universal health care would have to double from, say, 4 to 8 states as more states realize is what we want to do. And say back in 2046, that would double from 2 states doing it to 4 states doing it, which probably means sometime around 2040, we'd have our second state doing it, which means sometime in the 2030s, I don't know when, I'm making this up, we have our first state that does it. I'm not sure that's going to be Washington or that's going to be Oregon, or which state is going to be the Saskatchewan of the United States, essentially, to get us started on that. But I'm wondering, given that kind of end game, how do we get to the first one? We've got a commission that I've heard of at the state level that is or a committee a work group that is trying to come up with a plan for how Washington State would go about doing that, including how would we fund it and what happens to the insurance companies? Do they have a role in it? And et cetera. And I'm trying to figure out for the PNHP organization and for SNaP, what can these two organizations do to help get to that seminal moment somewhere in the 2030s when the first state signs into law their single payer universal health care?
I'm going to take a privilege to butt in here that we've got Chuck Panaccio, the president of One Payer States, who's devoted his life to answering the question and working on the question that you just asked. And I don't know if Chuck is on the other side of the country in DC and Pennsylvania, so maybe he slumped off there. But Chuck, if you're awake and heard the question, we'll give you 5 seconds.
There, great.
Hey.
Thanks, Dave. Yeah, I don't. And Ted, thank you. And I'm just thrilled to be with UW students and others working on getting us to expanded and improved national Medicare for all. That's our theory of change at One Payer States. I don't know how many of you heard of our organization. We've been around 15 years, but our theory of change is that we work through multiple states and even regional collaborations to get to modeling universal health care at a local, state, or regional level, much as Canada did back in the 1960s with Saskatchewan, and that ultimately led to Medicare for all nationally for Canada. And this model is replicated across the globe. We just rolled out our state-based universal healthcare legislation with Ed Markey, Senator Ed Markey from Massachusetts, and Congressman Ro Khanna from California just yesterday. And we had 7 state legislators come to DC, and we had people lined up. We had Hasakawa from I just wanted just to set up that we launched our legislation just yesterday. The press release is going to go out tomorrow. I'll drop in the chat our 38-minute press conference that we did in front of the Capitol. It was awesome. There is hope. I like to call it radical hope that we're going to get this done in 2029. We're going to get Trump out of power. We're going to get this done in 2029. And this is the pathway. Our theory of change is this is how we're going to get to national Medicare for all. Yeah, so the process of doing this is really unfolding. And what happened last week, with the big ass, terrible, horrible bill that is just destroying our public healthcare system, is on the other side of the tragedy, is creating an opportunity for understanding that we've got to move very quickly. And we can get legislation passed through Congress for the state-based universal healthcare acts even with Republicans. I know how crazy that may sound to you all, but I've been knocking doors on Capitol Hill for the last 2 years. And I think that we really are at a tipping point. People are really exasperated, are frustrated, and the opportunity really is in the air. So my name's Chuck Pinocchio. I'm president of a group called One Pair States. We were founded back in 2009, 2010. And at that point, we collaborated in creating economic impact studies to make the argument to win over the politics of the middle and the right, and that we've got real momentum on our side in spite of everything that is happening, right? All the craziness, all the fascism, all the tyranny, all of the the Trumpism that's in the air right now. So Ed Markey is stepping up to be the face of the single parent movement in a way. We have Pramila Jayapal with us. Pramila spoke with us, and she was very deferential to Markey and to Kana, that the pathway forward really at this point is through the states as well as through regional collaborations among and between states. And this is the work that's happening really off the radar screen. For the most part, the media is not covering this, but this is the work that's being done right now. And so grateful for the work that you all are doing and your commitment and your passion to getting us to a national Medicare for all single payer universal healthcare system. So thank you so much for the work that you do. The hour is late. I'm exhausted. I've spent the last month trying to stop this horrible bill, and then this last 7 business days trying to get our state-based universal health care bill launched with as many sponsors as we can. We have 23 House members. We have 4 Senate members that are on board. But I think the resonance and the connection and the understanding that the crisis that we're in is really connecting with any number of members. So thank you all so much for the work that you do. And just know that on the ground here in DC, as crazy as it is, and it is absolutely crazy, that we're fighting to get a healthcare system that's rational, that's patient-centered, that's provider-friendly, that gets the not only the for-profit, but I call it profit-first incentive out of healthcare, get the money incentive out of healthcare, and then we can get where we need to be, which is a healthcare system that allows you as future docs to do your job without having to look over your shoulder, without having to fight insurance companies, without having to deal with red tape, or in the case of many doctors, having to join corporate, hospitals, and to be dealing with a quota system, where you have to, where it's assembly line medicine. That kind of stuff is not why you went to medical school. You went to medical school, and you are going to medical school to take care of patients. And that's our focus, is to make sure that we get a healthcare system that's actually that actually matches your ethics, your values, and our values, to make sure that everybody gets covered. So thank you so much. I'll put my contact information in the box here. The hour's late here in the East, and I've been at this for a while, but thank you so much. Love you all.
That is awesome, Chuck. But a question for you, Chuck. Where can we learn more about State-Based Universal Healthcare Act? Is it on your website, the onepayerstates.org?
It is. It is there, and we'll be posting things. And I'll drop a link for the 38-minute press conference that we did. This is the first press conference we did. We had representatives from 7 states, and we had others, including Washington, Oregon, Minnesota, California, who wanted to come in but couldn't. But we had reps from Colorado and Maine and Michigan. The single payer leader in Michigan, Carrie Reingans, is amazing. She's somebody who actually gets the politics, the policy, and the strategy to win. She's only been involved in full-time politics for 2.5 years, and I've been in conversation with her for the last 2 months. And she is somebody who is a real organizer. And so there is hope out there. Absolutely. I call it radical hope. And there are people who really want to make sure that you're moving into a healthcare system that you can be proud of and that you can operate in professionally, with integrity, with the patient at the center, and marginalizing the profiteering health insurance companies, the pharmaceutical industry, the medical device industry, and the medical, the medical device industry, to make sure that we get actual care to the patients that we need. So I'll drop some links in the chat. Thanks, Ted.
Sure.
Thanks, Chuck.
Thanks, Chuck. I also wanted to weigh in on this question too. So yeah, thanks so much for bringing this up, Ted. And I really appreciate you laying out a timeline. I think it's always good to put numbers and give us like a threshold for when we're gonna get this done, as opposed to, just doing what we can when we can. Like, let's get some numbers down and let's have a goal. Also wanted to kind of challenge us to think, we can talk about single payer healthcare, and I think that it ultimately is the goal of a lot of single payer organizations, including PNHP and SNaP. But I want to challenge us to also think forward beyond single payer, because I'm hoping that, and I think this is reflected in our values in this organization, along with other medical students I've worked with at PNWU and UW and across the country, that how do we achieve health justice, right? So I'm going to argue, and I'm going to stand by this, that single payer is not going to give us health justice. It's going to move us in that direction, but in order to actually remove overall health inequality, I think we're going to have to think much bigger than that, much bigger than single payer. But single payer is absolutely a stepping stone in that direction. But thinking kind of more presently, everything that's been happening with this administration, but I would even argue previous administrations as well, Democratic administrations, we've been moving in the wrong direction. We've been incorporating more money, and we've been relying so hard on a handful of politicians who try to stand up and speak out for us. And there are a handful of heroes. But what I challenge our organizations, not only with physicians and medical students, but we really have to think about grassroots organizing. And I think medical students and doctors were poised to do really great things in that front, just considering how many people we interact with on a day-to-day basis, especially people who are interacting with the medical system at its worst and also sometimes at its best. But I'm just thinking of a specific example. One of my colleagues, Natalie, she's another fourth-year medical student, but she is definitely thinking on this level as well. With every patient that she interacts with, who we ever talk about insurance or anything like that, she gives them her business card. She sits down with them one-on-one, and she builds those connections, and those individual connections turn into networks, and those networks turn into webs of grassroots organizing that can ultimately move our politicians, whether they're Republican, Independent, or Democrat, in the right direction to ultimately passing legislation. How we do it on a state-by-state basis as well, I think capacity building is going to play a big factor, especially with medical students. I'm working with these students at UW, along with like PNWU and across the country. Like I said, I think the PNHP and SNaP in our national meetings and some of the workshops that we've hosted, building the capacity of current students to not only become advocates for themselves and for their patients, and to tell their story and to network and to build our networks, but also think more broadly about running for office themselves in the future. Just thinking back to even the founding of this nation, a handful of the signers of the Declaration of Independence were doctors themselves. And I want us to have that same kind of energy of encouraging medical students, encouraging young physicians and old physicians alike, or anybody across the entire spectrum, to run for office, to ultimately make some of these decisions themselves, right? Because right now, relying on politicians and leaning on them and utilizing individual meetings and sitting down with them and phone banking them with small organizations like this, we're moving in the wrong direction. I mean, I'm going to be losing my health insurance as a medical student with the passage of this most recent bill. Granted, I have a little bit of time to shop around and find another insurance plan, but that's kind of to give you a sense of the gravity of where this country's going in, the direction we're going in. We need to think really strongly about some of the tactics that we're utilizing to move forward. And I think some of the tactics that we've been relying on with smaller organizations and one-on-one meetings and trying to uplift a handful of politicians who can be our heroes, I'm not sure if that's going to get us across the finish line.
Well, thank you for those comments, John and Chuck. Do we have time for any more questions, or are we done with this session?
I guess I'll add to what John was saying. I encourage you to run for office. I waited until I was 52 years old to run for office, and I have no regrets other than I wish I'd started sooner. It is a great way to give back to your community, and it is thrilling and a little scary when you first do it. And yes, it's a huge burden in terms of I have a full-time job and I have this job as city council member, which doesn't really pay a lot of money. But it is a way to make a difference and to give back and to look back at the end of it and say, wow, okay, it was worth it.
Okay, I would like to nominate John Carney for the next senatorial race in the state of Washington. Any seconds?
I'm definitely second.
Second.
Yeah, you need a campaign manager. You got a team right here.
Yeah.
Oh, Margaret, you want to make a comment or a question?
Comment, it freaks me out. I'm home watching TV and Medicare Advantage, they've stole the word Medicare. How can we, with legislation, patent it so that when they say what it is, everybody knows it's the only one they want. Something like that, Just to comment. These young students, they might know like one payer, single payer. I tell people to look for a candidate who speaks about single payer, but why not one payer, right? Or just patent it and have these legislators say, we own this word. Can we do that? Thanks. That's all.
I just wanted to quickly bring something up just because we have people from like the other schools and possibly like undergraduate schools. I just attended the PNHP Communications Committee meeting a few days ago, and they're really trying to have people like start posting or like making posts and content for Instagram, but also like video content for like TikTok and like Facebook and stuff. And I thought it would be a really good time to shout that out because I mean, I know as medical students, we're really busy to do stuff like that all the time, but if like the undergraduate, like pre-meds would want to do something like that, I think that would be really cool. And I could kind of drop like the Slack that they created for that committee in here if anyone was interested or wanted to share that information.
Oh, not just anyone. You're talking about Alan Duo, who's on the call right now.
Yeah, I'll do
Our
it.
favorite undergrad.
Yeah, well, you send me that. I'll send my email and you can just forward that to me. Yeah.
Okay, awesome. Because they were talking about creating TikToks, and I didn't think me or anyone on that call was knew how to do that. So yeah, I think it'd be really great to have like kind of the younger crowd be more involved on the content creation side.
For sure.
Okay,
Thanks
cool.
for sharing that information, Simi.
Yeah.
Okay. Seeing no further hand raised, Sherry.
Oh,
David has finger raised.
No, I just
Okay.
wanted to say that in the next few days I'll have this online, and there's various links here, and I'll make them easy to get to from our YouTube channel.
Yeah, very, very good, very instructive meeting.
well,
Okay, last but not least, Sherry.
yes, I just want to thank you all so much for coming. I found this one of the best monthly meetings we've had, and I am so, as an almost 85-year-old, I am so glad to see younger people picking up the ball and running with it, hopefully.
Here,
So
here. Thank
yeah.
you.
So hang in there, everybody.
All right, so I'll end it with 5, 4, 3, 2, 1, 0. Okay, 5,
Bye, everybody.
4,
Hugh, did you have something? Oh, you're just waving goodbye.
1,
Okay.
0.
Bye bye.